702.
Health and wellness.
So, on our health and wellness feature today, we're talking about body dysmorphia. This body dysmorphia disorder, which is a mental health condition that disrupts how you see and feel about your body and appearance. But we've got a guest who knows more about it, who's going to chat to us. And as we try and understand more what it is and how to deal with it, as always, I want you to also join in the conversation. So have you or your loved one experienced body dysmorphia disorder before? What shape did that take? How did you respond to it? How have you overcome that disorder if you've been able to do that? 011-883-0702 is the number to dial, or you can send us a WhatsApp voice note on 072-702-1702. Batseeba Mothoa is a clinical psychologist who's going to guide us through this chat. Batseeba, thank you for making time. Good morning.
Good morning, Clement. Thank you very much for inviting me.
So what exactly is body dysmorphia disorder, or BDD, as some say?
So BDD, remember in psychiatry we have like umbrellas of disorders, like your mood, your cognitive. So this is actually a disorder that falls under the obsessive compulsive related disorder. We usually loosely talk about a person being OCD. So because it falls under this category, this is a category that is related with, rituals and these intrusive thoughts and, one's need to control, these thoughts. So meaning that BDD is also, as much as the person is obsessed with their features, being obsessed with their features, feeling like they look ugly, even though the other person, people around would give them feedback to say, but you look okay. But this concern is not just enough. It has to be followed by, the behaviors that they will perform to like looking at themselves at the mirror, always checking themselves and making sure that they look okay and presentable.
Mm-hmm. Okay. How is it different though from just, when I'm just unhappy with how I look?
Okay. So it's different because, when you're unhappy, we have to look at the language that the person uses. So it's not just feeling unhappy, it's the irrational perception. Because everybody else, when they look at this person, they look okay. So there is an element of exaggerating whatever deformity, that they might actually be observing in themselves. So it's the irrational thoughts of this perception of themselves. Because when you really look at them, there's really nothing wrong. They look normal. But to them, they don't look okay, they look ugly. Mm-hmm. A typical example would be the Picasso. There's a nice picture of the Picasso where you see this distorted feature. And they look at themselves, that's what they see.
Okay.
Yeah.
And what are some of the common signs, though? Because some people may probably are listening to us and thinking, okay, I do have those moments where I really don't like how I look, or I think I'm ugly, or I think, this part of the body could look better, but I don't know whether that is extreme or I've gotten to that extreme level. So what are some of the common signs or symptoms that someone might actually be struggling with body dysmorphia, and they might want to take that seriously? And it's not just a matter of, I don't like this look, or yes, some people tell me I look fine, but this is what I see. What should we look out for? What is it that they're unhappy about? Is it just one thing? It's my nose, I don't like it. Or is it just my eyes? What we've seen with body dysmorphic disorder is that the preoccupation is not just with one part of the body. It would be at least, 1 to 7 parts of their bodies. Mostly it's the face, but it will go down to other parts of the body. So if this person, what we look at is, fine, you are complaining about this appearance that you're not happy about. How is it affecting your day-to-day? How is it affecting your relationships? So a person that we need to worry about is a person who starts now avoiding social, settings, avoiding going out. It might look like a bit of social anxiety, but this is different. It's because they're worried that when they go out, people are going to look at them and then they're going to judge them according to their looks. And the people, mostly they're depressed,
there could be an element of depression, because literature tells us that most people who suffer from body dysmorphic disorder, they also have depression. So you will pick up on elements of low self-esteem, poor confidence, which we normally see, as a symptom of depression. But this could be worse because it could be worsened with suicidality. So the problem with suicidal ideation is that sometimes people might not, necessarily mention that actually I am thinking about death. But the content about the future, are they hopeless? Are they feeling, when they talk about the future, are they talking about it in a positive manner?
Yeah. So in your experience, Batseeba, is it mostly young people who suffer from this? Because I'm just thinking about, for instance, like look at social media and the role that it may play in just exacerbating this, where social media and beauty standards, I imagine they play a role in body dysmorphia, particularly among young South Africans. So in your experience, are there more adults? Is it more young people who are mostly on social media who often get affected?
You know what, Clement? Clinically, it's very rare to come across this case, right? But I would say that with the amount of, the body, in terms of representing the body in a certain way, in terms of beauty, that does play a role in terms of, affecting, I would say, most young people they get depressed because of this. So the most time, literature tells us, most time that we would actually find these people is when they come for surgery. When they do seek plastic surgery, that's when you will sort of like find maybe around 5% of people who end up there. That's when you will pick them up, or if they go to the dermatologist, because they will go there to actually fix these features. But the fixation around beauty standards and what is acceptable, what is, what makes you feel good in terms of, the way it's being portrayed by the media, it does have a great influence, because people feel if I don't look this way, then I'm not acceptable. So it can actually influence some of these symptoms, because we tend to, it's called modeling. So now, as a young person, who do I look up to? So celebrities are the people that, are the young people who will look up to. So when they look at themselves, they will actually think, they would use that as a value system for themselves. And we know that adolescence, it's a very fragile stage. That's when, the sense of being is actually built. So I think social media does play a role. And even in terms of onset, we can see that most cases are shown to actually start around, they're more prevalent around the adolescent age. And then we'll see them mostly, later on in life. And I think it's because then people are older, people have access to money, they have access to certain services. They can try and do something about these features, and that's when they can actually be diagnosed.
Okay. I've got some WhatsApps that have come through on 072 702 1702. Calls on 011-883-0702. So we'll start with them after this break.
702. Health and wellness.
Body dysmorphia is what we're discussing on our health and wellness feature this morning. Let's go to your WhatsApps.
Hi, Clement and the team. Jeesh, I think I'm someone who definitely suffers from body dysmorphia. I think they call it BDD. Ever since I was told that, oh my gosh, you've gained weight, back when I was in grade 8, I think. Ever since then, it's probably been a roller coaster ride of, going through, food problems, bulimia, anorexia, gaining weight and whatnot. And you just never think you're beautiful enough, no matter how many times you're told you're beautiful. How I overcame it is I always just make sure I eat healthy, work out, try to listen to a lot of, good mental awareness thoughts. Yeah, I don't want to waste too much time saying.
Hello, 702 listeners. I really need help. I think the topic of today really targets me. I've been suffering from this thing of believing and trusting that I have bad breath. So now if I date a person, I will just keep my distance. Kissing is a no-no. At work, I cannot perform well because some people will ask, why can't you open your mouth? Why can't you do this? So it's my belief. But then it gets deep because I feel like people are lying to me. So meaning I have it, but nobody's able to confront me to say, okay, you actually have it. I went to the dentist. The dentist says there's nothing there, but I still feel like I do have it. Every time when I see people on TV, like actors talking next to each other, I always think to myself, can they smell their own breath? Like, how bad is it? Is it like I fear? I don't talk to people who are close to me, so I keep a safe following distance before I can open my mouth. I've been suffering from this, and I'm still looking for help even today. Thank you.
Hello, this is Ben from Heart of Beersport. I'm a philosopher of medicine. I'm curious whether your guest has any insights on why BDD is considered a mental disorder, but gender dysphoria isn't. When actually, from what I understand from the conversation, the two conditions seem very similar, except insofar as one specifically relates to gender, and the other relates to sometimes maybe identifying as being disabled when you're not, something along those lines.
Oh, thank you for the questions. Batseeba?
Hi, how are you?
Yeah, you can go ahead.
Yes. Okay. So where do I start now? Clement? Guide me.
So you can start with the other one was talking about bad breath and how they need help. They're concerned about, they often don't want to speak very close to people because they feel like their breath smells. And they're saying they've had this for many years. So she says she needs help. Any advice on what she needs to do, and is that considered a body dysmorphia?
You know what? That was a very interesting one, actually, the way she actually described it. So already we can see in this case she has been to the dentist. She's doing everything. That actually, it's confirming the opposite. It's not confirming that there actually is a bad breath. So you can see there is an element of delusion. So I would actually say that I would advise the person, because then we cannot really diagnose a person here. I would really advise them to go see, like a psychiatrist or a psychologist where they can be assessed properly, because you can see that there is a bit of delusion there, where there is that false belief. Even though the person, there is evidence that shows otherwise, the person is still obsessed to say, but I do have a bad breath, and it really is affecting, because remember I said there has to be an interference into their day-to-day. So if you cannot open your mouth and you are at work, so how are you going to be, effective in your work, in your relationships? You have to, actually have conversations with people. And so you can see that already her life is affected, because she has to talk, but she's not talking to people. It can even be considered as rude. So the fact that there is an interference, we can see that there is a clinical element to it.
Okay.
And and the difference between this and the explanation to the other lady, I'm glad that actually she raised something very important. So when you diagnosed body dysmorphic disorder, there shouldn't be an eating disorder. And I think she did explain utter something around bulimia. So if there is some sort of eating disorder, bulimia, obviously people will throw up to try and, make sure that they don't gain weight, and the others will starve themselves. And we also have something like pica, where people will be eating non-food elements. So I think in that case, the person rather goes to a professional, they deal with the eating disorder, because there could be other underlying issues then that, they could actually see an improvement. Okay,
the difference then between body dysmorphia, someone asked about gender dysphoria. Why is that not considered a mental illness?
Okay, so I think now we're stepping into, because remember I said we work with umbrellas. Yeah. So I think we're moving more into, what are we talking about? So we're moving more into the space of somatoform. So yes. So I think if you've checked, but gender, actually, it is considered a mental illness. I think the debate around it, gender, gender what? So,
dysphoria.
So if you look at it at the moment, which I think the challenge is the the statistical manual that we're using.
Yeah.
It's the one that actually put the different categories.
Okay.
But we sort of like moving into a thin line, because I think the DSM-4, we are currently on DSM-5, revised one.
Okay. What we'll do then is maybe next time focus a lot on gender dysphoria as well, just to get more understanding on that. Batseeba Mothoa, clinical psychologist, thanks for making time for us.